when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
Good morning, viewers, and welcome back to the Tobago Updates morning show, coming to you here live from the Port Mall in Scarborough, Tobago. I'm Julien Skeete, and we're just at around 7:22 a.m. this morning. And certainly we are happy to welcome on set with us Dr. Maxwell Adeyemi, primary care physician. And this time around, we're speaking diabetes, World Diabetes Day 2023. Good morning to you, Dr. Max.
Good morning, Julian.
And how are you doing?
Good morning, Tobago. Nice to be here this morning, yeah.
Excellent. So we're going to get the conversation started by giving us a little backdrop into World Diabetes Day that we celebrate annually.
Well, basically, the World Diabetes Day is a day that we mark or create an awareness for the disease called diabetes. It was recognized by WHO and usually programmed by the World Diabetes Federation and International Diabetes Federation. Basically, there are diabetes associations in every country. In Tobago, we have 2 diabetes associations. We have the Canaan-Born Accord group as well as the Scarborough branch. These 2 branches are integral part of the DATT, which is the Diabetes Association of Trinidad and Tobago, which is also the umbrella under which, the unit of the International Diabetic Federation, which is a worldwide organization.
All right. What we want to get into, just to begin to break it down, because some people have the traditional perspective where they refer to it as sugar. In terms of, but I wanted to get into it a little bit just to give an understanding for the purpose of our viewers and listeners. What is diabetes and how can one be tested for it? How can I be tested for it?
Well, basically, diabetes, as we know, it is a chronic disease, of glucose dysmetabolism, all right? It's a abnormal, glucose metabolism as a result of insulin deficiency, lack of, or total absence of insulin production. And it not only affects glucose metabolism, but invariably it affects carbohydrate, protein, and fat metabolism. As a result of that, there's a buildup of blood sugar in the body, in the blood, which eventually become inimical to the functioning of the body systems.
So to put quite simply, it's not a case of if I consume too much sweet or too much sugar, as the traditional the thinking might have been. I just want you to clear that misconception. Is there any truth to that? That it's exclusively connected, in terms of consumption of sweets and so on?
Well, basically, diabetes is a multifactorial disease. There are so many factors that comes to play. Consuming sugar only by itself is not necessarily what leads to diabetes, because there are some people who eat a lot of sugar and their body is able to cope with it. However, unbridled consumption of sugar puts a lot of burden on your system, especially the insulin-producing cells in the pancreas. Because the more sugar you eat, the more, insulin your body will have to produce. And over time, you can actually exhaust or tire out that system, and it could become a problem. But that is just one aspect of it. There are some other factors that may, play a part in, developing diabetes, which are sedentary lifestyle, genetics, hereditary, and stuff like that.
All right. So viewers, we're going to take a quick break. We'll be right back. We invite you to share the live, share the live, share the live.
When you're moving from place to place. Good morning.
Good morning, viewers, and welcome back to the Tobago Updates morning show. I'm Julien Skeete, and we're just at about 7:29 a.m. this morning, and we are continuing the conversation with Dr. Maxwell Adeyemi, primary care physician. It's the 14th of November. It's World Diabetes Day, and we're speaking about diabetes, just giving a little insight and more information, and just some things that you probably need to be asking your doctor on that next visit or check. So, Dr. Maxwell, we just went through, given an idea and a better understanding understanding and bringing clarity to defining diabetes. I want you to tell us a little bit about, what kind of health problems can be caused for persons who definitely have had challenges in terms of managing, being persons who are diabetic.
Sorry about that.
Doctors always on call, folks, always.
Basically, diabetes as a disease does have quite a lot of health, issues, complications that may arise from diabetes. I normally, educate my client, my patients, that diabetes generally is a head-to-toe disease. It affects practically every aspect of your life, every part of your body could be at risk, from your head to your toe. So you could have things like, stroke, Alzheimer's, dementia that could happen if it affects your brain. Your eyes just going down systematically, that could have like diabetic retinopathy, cataracts, glaucoma, and eventual blindness. If you go down a little bit to your chest, you see, you could have heart problems, diabetic cardiomyopathy, diseases of the big and small vessels of the heart. You could have heart attacks, stuff like that. Then you could go down into the abdominal cavity. You have things like kidney problems, most of the kidney disease that we have on the island basically as a result of, diabetes. More than half could be diabetes. Then you could also have intestinal problem, constipation, diabetes, gastroparesis, because the diabetes affect the nerves in the stomach and therefore makes, stomach activities and proportion, peristaltic activity difficult, so you could have diabetic gastroparesis. It could also affect your pelvic area, females and males. Your sexual organ could be damaged, in terms of having erectile dysfunctions for men and problems with women who basically may have recurrent vaginal infections, and obviously eventually may lead to some sexual issues as well. And then if you go down to your lower extremities, you have blood vessels damages as well, nerve damages, which may create a disease called diabetic neuropathy and cause problem with your sensations, your lack of feelings. And if any of those limbs got affected by any kind of infection, you could end up with gangrene and amputation. And so there could be so many ills that could arise as a result of diabetes.
And I hear you making that description from head right down to toe. What are the possibilities in terms of, is it something that you look out for, you do regular testing? Is there a particular age group? Because, we still live in a time where we feel as younger persons, I don't need to check for these things. Perhaps I'm still going towards my retirement time. Just bring some clarity there for us in terms of the persons that can be affected, and how soon should you really be doing that check or that test from time to time?
Well, basically, these days diabetes could afflict any age group now as we are. As you know, we have different types of diabetes. You have the type 1, type 2, and the gestational diabetes. Type 2 diabetes used to be, a disease of the aged people before in the past, but that is no longer the case, as we know, because of obesity, the lifestyle, sedentary lifestyle, and poor eating habits. Folks as early as 10, 12, 11 could actually come down with type 2 diabetes. So depending on when one is diagnosed with the diabetes, it takes roughly about 10 to 15 years before you start seeing complications. So it is always advisable that you check on a regular basis, because some people have this disease and they are not aware of it. So you could have it for about like 5, 10 years and you don't know. Your body have a lot of compensatory mechanisms to try to cope with this situation until eventually something gives in, and then you have a devastating, complication that may occur as a result of diabetes. So the key thing is to always check, especially once you have risk factors, like you have family histories, persons in your family that has diabetes, you're obese and overweight, so you have a sedentary lifestyle, you're above 25. Most of these categories of persons need to be screened on a regular basis.
So it's a safe thing to say, one of the questions that you should be asking your doctor, you suspect anything, what type of diabetes am I at risk for?
Right, really. the type 1 diabetes usually comes at very early age. Usually, most of these folks come down around 3, 4, 5 years old. You try, manifest, usually hereditary and stuff like that. So type 1 is total lack of insulin. So you will see the manifestation very early in life. That does not mean that people older than that cannot get type 1 diabetes, because you can diagnose type 1 diabetes in as old as 20, 21, 25 year olds, So, but you normally would know type 1 diabetes very early in life, okay? Type 2 diabetes, however, comes on later in life as a sort of maybe a lot of lifestyle, like, sedentary lifestyle and stuff like that. So the other side, gestational diabetes is something that develops as a result of the stress of pregnancy. Okay, so most women who are diabetic, sometimes they may be at risk, who become gestational diabetic as a result of the pregnancy. Most of the time when they are delivered of the baby, the diabetes resolved. However, 50% of them later on in life may eventually develop type 2 diabetes as well.
And I'm glad you mentioned it there. It's also important if it's in your family line,
right.
Because there is a possibility. Now, for those persons listening out there, I want you to share a little bit, just again for the sake of information and education, and to remind the persons, if you're diagnosed with diabetes, it's not the end of the world. I want you to provide some guidance in terms of how can diabetes be treated? How is it treated generally?
Generally, diabetes is treated, as patient-specific. Every patient's treatment has to be customized to, the person, their personality, what they have, what they can afford, and stuff like that. And largely, we start with lifestyle change, which will involve changing your diet, as well as change in your physical activity. Okay, you have to be able to be moving and be able to expend energy to kind of burn some of the sugar, and you have to be able to change your diet in terms of the calorific intake that you take. Okay, it's not that you cannot eat any kind of food. You can eat any kind of food you want as a diabetic, but everything has to be measured, customized, and be in appropriate proportion, right? So that is lifestyle change. If lifestyle doesn't work, then we go into oral medications. There are quite a few, over 10 categories of oral medication that you take by mouth and stuff like that. If oral medication doesn't work, okay, in combination or in single, monotherapy, then you can add injectable medications, which invariably involves insulin. And there are some other type of injectable medications now, but they're expensive and they're not really available here. But insulin is an option that we have. So it could be lifestyle change, medication, insulin, and stuff like that.
All right, and I want you to share with us very quickly before we wrap. We've spoken about persons right along in terms of being affected by. For someone who does not have diabetes, what's your advice to them in terms of how to continue operating, or the things to be conscious of to help prevent, in terms of preventative measures?
Basically, it's to know your family history. When you know your family history, so you know what kind of disease, diabetes or otherwise, that you have, and you will be able to structure your life in a way that you can avoid some of the problems that may come. But apart from knowing your family history, then screening is important. So maybe once a year, every 6 months, some people will do their testing just to be sure they're okay. Make sure that you are eating healthy as much as you can, okay? And healthy food are not necessarily cheap these days, okay? So, but you can find some kind of balance in what you're eating to include your carbohydrates, your proteins, and your fat, okay? Typical plate should actually include at least 1/4 of your plate meaning carbohydrate, another 1/4 will be like protein, and half will be fruits and vegetables. So when you follow that kind of pattern, your feeding or your eating habit is kind of structured in a balanced way. And then you also have to maintain a healthy weight, okay? So there's some way that you can get your height for weight, BMI and whatever. Make sure that you're within the limit of your height and, body structure, you have a balanced weight. And then physical activity, keep active and, keep moving.
Excellent. And Dr. Max, just before you go, I got to touch on that lighter side. People see the primary care physician, your official capacity employment, but I know even in your private life and your voluntary and community work, as early as this weekend, you'd have been involved with the Rotary Club of Southwest Tobago. Kudos going out. Successful execution of the annual diabetes initiative, of which you're a past president of the club. You've also been involved with the Diabetes Association, doing your work there, supporting even initiatives. Kudos as well to Eastern Credit Union over the course of the weekend. What's your word of advice and encouragement to those NGOs out there, community groups, and even companies with that social responsibility? How can they get on board with really providing that support and educating the public?
Yeah, thanks for bringing that up. Well, Rotary has been, as you know, involved in diabetes project for the past 10, 15 years, and we're doing it every year just to educate and enlighten people about the disease. The same thing with the Diabetes Association, of which I'm a part as well, the National Diabetes Association all across the island in Trinidad and in Tobago. There are a series of programs that have been taking place over the weekend, and including today as well. And kudos also to Eastern Credit Union, because they, for the past 12 years, they have been creating an awareness here for the walkathon, and this week alone, after the walkathon on Saturday, they have also donated over 100 glucometers that we are distributing to people who are diabetic or who like to be engaging in testing their blood sugar. Most folks who are diabetic, they just come and then we give them free testers for them to, be able to monitor their blood sugar. So kudos to Eastern Credit Union, because that's quite a great initiative.
Excellent indeed. So we're sending out those commendations out there. Eastern Credit Union, the Diabetes Association, Rotary Club of Southwest Tobago, and also our interactors out there, young ones providing that support in the mix, the Interact Club of Southwest Tobago. And this is just a gentle reminder of physicians like Dr. Maxwell Adeyemi, as well as a number of others we had over the course of the weekend, Dr. Rosalind Alfred Dumas, and a number of others. Please feel free to reach out to them in their private time. They will provide that level of support to help educate and inform, because as far as they are concerned in the medical sector, part of their crucial responsibility is also to prevent if they can, and education and awareness is certainly along that pathway. So today it's World Diabetes Day, and let's take that time out to get some information, to get some knowledge, to become more aware in terms of going forward. Thank you very much again, Dr. Maxwell Adeyemi, primary care physician, public health, speaking to us here today on World Diabetes Day and giving us a little insight and information. Viewers, we want to thank you so much for continuing to choose the Tobago Updates morning show, and to remind you that this is your opportunity to share the live, share the live, share the live.